Hello and welcome to the fifth episode in this series of podcasts on peripheral vascular disease. In this podcast I'm going to discuss the diagnosis and management of a ruptured abdominal aortic aneurysm. Ruptured abdominal aortic aneurysm is a surgical emergency which is associated with a significant mortality, and indeed 50% of patients with a ruptured aortic aneurysm will die before even reaching hospital. Patients present with sudden onset severe abdominal pain radiating to the back. In addition, they also present in hypovolemic shock as a result of hemorrhage. This includes a raised pulse, low blood pressure, prolonged capillary refill, and peripheries which are cool, clammy, and cyanosed. On examination, a pulsatile mass may be felt in the abdomen. The diagnosis of a ruptured abdominal aortic aneurysm is made clinically, and imaging investigations such as ultrasound should only be used if there is clinical doubt. Initial management of a ruptured aortic aneurysm includes assessing the patient's airway, breathing, and circulation, and resuscitating as necessary, but with judicious use of intravenous fluids. The patient should then be taken to theatre urgently for a repair to be attempted. It should be noted that the presentation of a ruptured aortic aneurysm may be similar to that of renal colic, with severe abdominal pain radiating down the flanks. For this reason, it is essential to rule out a ruptured abdominal aortic aneurysm in any elderly patient who presents with symptoms of renal colic. So to summarize, a ruptured abdominal aortic aneurysm is a surgical emergency characterized by hypovolemic shock with severe sudden onset abdominal pain radiating to the back, and on examination there may be a pulsatile mass. The immediate management includes resuscitation followed by urgent transfer to theatre for a surgical repair to be attempted. So this concludes this episode on ruptured abdominal aortic aneurysm. Thank you for listening.